My name is Dr. Jorge Flechas from the Nevada Center in Carson City, Nevada. Today we plan to discuss the use of oxytocin in the treatment of a disease known as fibromyalgia. One of the first things that I would like to approach with you is the fact that oxytocin is the hormone that we give women to induce labor to have a child. It's the hormone that we give women to help them to have milk in their chest when they're nursing a child. It's the hormone that's released when humans have relations. It's a hormone that is missing in children with autism. And there have been studies in the medical literature suggesting that oxytocin also works as a painkiller. So in the first slide that we have here, we look at the words oxytocin and pain. And there was an emergency room doctor who discovered that if he gave intravenous oxytocin to a patient, that it would take away the patient's migraine headaches. We have known for years that if a patient with a migraine headaches was induced to have an orgasm, that there would be literally a stoppage of the migraine headache. It would totally disappear within seconds. We have since been able to identify that the events that surround that event are basically a massive release of oxytocin from the brain, and that taking away the headache. This emergency room doctor was able to show that giving oxytocin IV was able to get rid of a patient's migraine headache. They have also found that patients who have low levels of oxytocin have a higher problem with abdominal pain of psychosomatic origin and inflammatory bowel disease. And they have discovered that if you give oxytocin to patients with abdominal pain, that the abdominal pain associated with inflammatory disease, that the oxytocin will help to decrease the person's pain. Oxytocin significantly increases the threshold for visceral perception of pain in patients with irritable bowel syndrome at doses equal to or greater than 25 microunits per minute, possibly by acting at the level of the visceral afferent nerves of the intestine. We have now been able, in research that's been done in the intestine, been able to identify oxytocin receptors throughout the whole intestine, and that when given oxytocin, that the amount of pain the amount of inducible pain that a person undergoes goes way up before they finally sense the pain to be present when there's plenty of oxytocin on board. Oxytocin has been given to get rid of back pain in some studies that were done in Chinese human subjects. The effect of oxytocin on low back pain in patients and its mechanism in rats were investigated. The conclusion, these results showed that oxytocin induces analgesia, that is, oxytocin takes away pain in the lower back involving the endogenous opioid peptide system, and may be effective and safe in acute and chronic low back pain. In essence, the body makes a series of hormones called endorphins, and oxytocin stimulates one of those endorphins known as enkephalins, and oxytocin stimulates the enkephalins to help increase the ability of the body to withstand pain and to actually take it away. And this happens inside the cerebral spinal fluid and inside the central nervous system. Now, oxytocin has been found to be low in many different diseases, such as depression. And you will notice that many patients who have fibromyalgia have been accused of being depressed as the source of their pain. And they actually may have problems with depression, but it's interesting that low oxytocin has been found in depression. We know that children with autism do not make oxytocin regular. They do make lots of oxytocin peptide, which is the precursor to the real hormone oxytocin. Children with autism are missing the enzyme that's necessary to convert oxytocin with its peptides into the free form of oxytocin. AIDS patients have been noted to have low levels of oxytocin. Patients with multiple sclerosis have been noted to be low in oxytocin. Low estrogen states and low thyroid T3 states are also associated with low oxytocin blood levels. It's of interest that estrogen and thyroid T3 both can stimulate the cells of the hypothalamus to produce more oxytocin. Hence, when a woman goes through menopause, and her estrogen levels start dropping, so does her production of oxytocin. And it's interesting that the peak of when women or humans are diagnosed as having fibromyalgia muscle pain is at about age 48, when most women are going through menopause. In fact, many women who have gone through menopause will tell us that one of the symptoms that they don't like about menopause is the achiness that it comes with the lack of estrogen. Patients with low thyroid T3 have again also talked about the achiness that comes. And again, fibromyalgia is basically a disease of increased muscle aches and pains. It's not a disease of the joints, it's a disease or a medical problem of painful muscles. Chronic stress situations will also lower oxytocin levels. I've seen this where a woman would be nursing a baby and her husband comes up and says, "I want a divorce." Even though she has a baby that is nursing with her and should be getting some milk, because of the stress of the pending divorce, the stress will decrease the production of oxytocin inside the brain, and hence her breasts will dry up with no milk, even though she's got a baby that is still trying to nurse. Patients with chronic opioid use also have problems with decreased oxytocin production. There is a disease complex known as Prader-Willi syndrome, and in Prader-Willi, these patients have decreased amounts of neurons or brain cells inside the brain that are not producing oxytocin. So many of these patients have very low levels of oxytocin, but it's because there's not enough nerve cells to make it. We have seen oxytocin deficiency in patients with Parkinson's, and in patients with fibromyalgia, they have also identified the lack of oxytocin. Of interest is that there are many of these diseases that will mimic or look like fibromyalgia, this problem of muscle aches and pains, and it turns out that it's of a different origin. Now, we at my office gave some patients with fibromyalgia, we took about 18 patients and gave them 10 units of oxytocin with 1/4 of a cc of lidocaine. And we did it for about twice a day, or we gave them a 10-unit tablet of oxytocin that was sustained release. What we found is that there was a definite statistically lower problem with muscle pain, joint swelling, and that would be the tissues that surround the joints. And there is such a thing called a fibromyalgia impact questionnaire, which with these patients, Their score went from 55.6 down to 30.9 with a p-value of 0.000003, suggesting that these patients definitely had a much improved score with the use of oxytocin. At the time of an office visit, when a patient shows up at my office having severe pain, we will give them a shot of oxytocin. About 20% of the patients will blush. Now, blushing means here that the skin, usually for these patients, is pale white. Their hands are cold, their feet are cold, and when you give them the shot of oxytocin, their white skin turns ruddy. They look like they got a light sunburn. Their ears turn bright red, and the ears turn as hot red as the lips do. But that's only 20% of all the patients with fibromyalgia. No blushing with oxytocin is usually due to a lack of DHEA, the primary steroid of the adrenals, and or a defective phosphatidylinositol pathway. This pathway is what's responsible for, in the evening, what is called lightning bugs. When a lightning bug lights up in the night sky, the lightning bug is activating the phosphatidylinositol pathway, and that's what allows for us to be able to see the light of their tails. The phosphatidylinositol pathway is the same pathway that's activated when you go driving at night and you're able to see different things at nighttime, such as driving a car on the freeway or the road. People with a defective phosphatidylinositol pathway would tell you such things as, I've had to stop driving at night because I can't see the road anymore. And what they're telling you is that the pathway has become defective. So if a patient cannot blush with the use of oxytocin, we have had patients who have come in taking nitroglycerin and have told us that their muscle pain goes away. Think about it. A patient has angina of the heart. It's a muscle. And with the use of nitroglycerin, there is a decrease in the pain of the heart. We see the same thing with the use of nitroglycerin as far as the muscle pain in the body. And it was patients with angina who came in with fibromyalgia who sat there and said, anytime I take my nitroglycerin for my chest pain, my total body pain also goes down. Researchers in France were able to demonstrate that the chemical that's released by nitroglycerin, called nitric oxide, is also responsible for helping to get rid of the pain of fibromyalgia. So if we give a person oxytocin and only 20% respond, we then will give them some nitroglycerin, 0.3 milligram, 1/2 of a tablet sublingually, and another 53% of them will blush. Blushing not only signifies that the patient responded, but they will also tell you that the muscle pain in the body goes away. We have seen that about 20% of all, or 27% of all of our patients do not blush with the use of nitroglycerin, and it turns out that that's due to a sulfur deficiency that's present inside the body. If the injection of oxytocin induces a headache, consider an obstruction of the foramen magnum at the base of the brain or the skull due to the cerebellar tonsils obstructing the foramen magnum. These patients usually will show us that they have a big brain, a small skull, and their brains are trying to herniate out through the base of the skull. As a result, these patients will complain of a pressure-like headache inside the head when they get exposed to oxytocin. Oxytocin is a vasodilator. It helps to improve on the microcirculation throughout the whole body, which explains why when you give a shot of oxytocin, the ears turn red, the whole body starts turning red, and in actuality, there's increased blood flow to the brain, which is now making increased cerebral spinal fluid. That fluid gets stuck inside the head, cannot go down to the tailbone area of the spinal cord, and as a result, the patient will tell you about a pressure-like headache inside the head. Now, what you will see here on this picture is a small, the brainstem towards the very middle of the slide, and then just immediately to the right, an area of what is the cerebellum. And you'll notice towards the bottom of the cerebellum, there is an area that looks like a small triangle. That area is the part of the brain that is being pushed out of the head. It is totally obstructing the brain fluid from being able to get out of the brain and get down to the tailbone area. And if you increase the amount of fluid production in the head, the patients will complain of a pressure-like headache. Another way to do that is to exercise. When you exercise, you increase the amount of heart action, which increases the pulse rate, which increases the amount of fluid production by the brain, and as a result, the patients will tell you that they have problems with pressure headaches with exercise. This would be a clue to let you know that there may be a problem here at the base of the brain where there may be an obstruction. In years before we could do surgery to repair this, we would end up with children who had problems with enlargement of the brain, as we can see here under the title Oxytocin and Head Pressure. You will see that these children used to have problems with very big heads, secondary to the fact that there's a buildup of pressure inside the head and no way to relieve the pressure. We have also noted that in fibromyalgia, there is a problem of a decrease in sexual activity. And we have seen that when we give patients an injection of oxytocin in the medical office, that some of these patients will get turned on sexually within about an hour. Of interest is that in America, 1 out of every 4 women has been sexually assaulted. The oxytocin injection may bring back very strong sexual feelings that she may want to forget. So as a physician, you should have these patients report back to you within 24 hours if anything like this should happen to them, so that you can help to diffuse some of the problems of problems that occurred when they were younger. Of interest is that 13% of all American women are multi-orgasmic. In patients who are taking oxytocin for fibromyalgia pain, 53% of them will become multi-orgasmic. Again, this has been seen in the medical literature where oxytocin helps to facilitate the ability of women to become this way. Another issue with fibromyalgia is what we have seen in that is it's called fibromyalgia pain and iodine. If you will go to the Optimox.com website and look at the iodine research articles that have been published, you will find a medical article about a patient with fibromyalgia who was given iodine due to a defect in iodine absorption at the cellular level. With iodine repletion, her muscle pain went away. I have seen the same problem multiple times where we gave iodine to help get rid of the breast pain of fibrocystic breast disease and breast pain, and seen the muscle pain go also away. We have basically seen that iodine deficiency in the breast manifests as painful breasts just before a menstrual cycle. And iodine helps to take away that pain of the breast, but it also helps to get rid of the pain in the muscles. Of interest is that when you look at iodine metabolism in patients, that 3% of the total iodine in the body sits inside the thyroid. The body can hold 1,500 milligrams of iodine in totality. The thyroid only holds about 50 milligrams of the total 1,500 milligrams. 20% of all the iodine sits inside the skin. 32% of the iodine sits inside the muscle. 35% of the iodine is in the fat, and 10% of the iodine sits in the rest of the body. Now, when you take away iodine from the thyroid, you get a goiter. And usually goiters are cysts, nodules, enlargement, and scar tissue of the thyroid. When you take away the iodine from the breast, you get cysts, nodules, enlargement, scar tissue, and now we add to that pain, and that's what's known as fibrocystic breast disease or fibrocystic breast pain. In today's world, it's also known as benign breast disease. Lack of iodine to the ovary, you get cysts, nodules, enlargement, scar tissue, and pain, and we call that polycystic ovaries, or problems with recurrent cysts of the ovaries. Low iodine to the skin, patients do not sweat. So you'll see people who go around telling you that I can work outside in my garden, I get hot, but I don't sweat. Or I may break out with a drop or two of sweat on my forehead or around my ears, but no sweat anywhere else in the body. These people are usually iodine deficient till proven otherwise. Iodine deficiency in the muscles will manifest as fibromyalgia. In this case, the patients have nodules, enlargement, scar tissue, and pain, but we have not been documenting any evidence of increased cyst in the muscle. Iodine deficiency during fetal life will show humans that have low IQs, attention deficit disorder, and cretinism. And a cretin is a human being that is totally mentally retarded, very short stature, and these people are usually and it's all due to the lack of iodine, not only during fetal life, but also in the first few years of life. Why does oxytocin work? It is known that oxytocin stimulates the sodium iodide symporter system of cellular absorption of iodine. In essence, oxytocin stimulates the mechanism at the cellular level inside the body to increase the absorption of iodine into a cell. And once you get the iodine into the cell, then the iodine works as a painkiller inside that area. Oxytocin is a painkiller in its own right, working inside the central nervous system. With no oxytocin made in the body, as seen in children with autism, I frequently will see patients have muscle pain present, especially with these children who are autistic. You can take these children and you can just lightly touch their skin and they will ouch and complain of pain with the just light squeezing. We have seen that fibromyalgia is basically a disease of muscle pain. The muscle pain can be due to a whole listing of different etiologies, but probably in America the most common source of this problem is the absence of iodine. If we can be of further help to you concerning fibromyalgia and iodine, please let us know. Give us a call here at the Nevada Center. Thank you.
For more information, contact the Nevada Center, 1231 Country Club Drive, Carson City, Nevada, 89703, or call us at 775-884-3600. 3990. And be sure to visit our website at www.antiagingmedicine.com.